You know that we're talking about these adaptations, right? We're increasing the size of shapes, we're increasing the size, we're talking about increasing the number of cells, all right? So what are these? These are the different adaptation mechanisms the cell uses to what? To maintain its steady state, or to meet is what? Homeostasis, all right? So that's why we'll be talking about. These are four cells, right? The different ways cells adapt, okay? That's the thing we'll be talking about. So let's say this is four cells right here, all right? These are four cells, and we'll talk about this. You know, whenever you have the cells, right? Look, let's just say. We'll make this as a different color right here. Look, if you have a cells right like this, all right? You have two. Now these are exactly the same, right? And then, but then let's say, what about these cells? You know, there was increase in the cells like this. All right? And there's obviously, there's going to be the black color right here. Nucleus, right? Look, what is happening here? The cell, this is a normal cell. But what happens is that with a certain stimulus, the cell went and multiply, right? Multiply, and what you got to see is there's increase in number of cells. When you increase the number of cells, let's just say this is one organ right here. When you increase the number of cells, what does happen to this organ? It becomes bigger, it becomes larger. So by increasing the number of the cells, there's an increase in what? Increase in size of the organ, all right? Or tissues. So what do we call that? This is one of the adaptations that cell does, all right? And that is called hyperplasia, guys, all right? Hyperplasia. So whenever you hear aplasia, think about growth, all right? There's an increase in the numbers of cells, which is leading into the increase of like size of the organ or tissues. That is what's called hyperplasia. So if there's a hyperplasia, that means there will also be hyperplasia too, hypoplasia, and there is, but it is not very clinical. It is not very like high yield that people often talk about it. But basically means hypoplasia basically means a decrease in the number of cells that reduces, you know, the cell organ. All right. Oftentimes they use aplasia. All right. Let's write down aplasia. Okay, I'll just write down hyperplasia too. Which basically means is that this is a four cells right here. Maybe it went down to, let's just say, and then it become like just three. All right. Now, other one is what? Okay, this is gonna be, let's see, aplasia, right? Aplasia basically means is that, okay, aplasia basically means is that, you know, there's absent or there's no cells growth at all. That is what basically aplasia means, all right? So whenever there's aplasia, there's no growth or there's absence of cell growth. That's what aplasia is. Hyperplasia, there's a decrease in numbers of cells. Hyperplasia basically means there's increase in growth, numbers of the cells, that increases the what? That increases the size of the organ, all right? Now, we also have to talk about, there's something called concept called like anaplasia too, like there's dysplasia too, all right? Whenever you hear like anaplasia, it's always gonna be like it's always gonna be carcinoma. That's always gonna lead into cancers. That's something that I wanted to quickly emphasize. But this hyperplasia and aplasia is one of the most important things that you should be knowing, all right? Now, after that, let me talk about some other stuff too. What about the hypertrophy? Look, we have to talk about trophy. Look, what has happened here, guys? Look, hypertrophy. Hypertrophy basically means is that, look, the numbers of cells did not increase. You have to know this. You need to know what is the difference between hyperplasia and hypertrophy. They're not the same thing. Hyperplasia, whenever there's a growth in the number of cells that increases the size of the organ. But whenever hypertrophy is there, what is that? These cells are already differentiated. What happens is that this mass, this pre-existing mass, look at this. This has been increased. And the way it increases, there's a lot of maybe protein synthesis were there, like protein deposits in there. So because of that, a lot of the organelles they got bigger, all right? So because of this, when the mass is bigger, right, the size of the organ also gets bigger. And this is what is called hypertrophy. And usually this happens usually with like a brain, all right, or the most important thing is myocytes, like heart muscles. Remember, and the way it works is like when you increase the workload, right, these are already differentiated cells, all right, heart muscles, they're already differentiated cells. And when you increase the workload, when you're pumping, what is going to happen is that, these guys are going to get bigger in their mass, all right? Same thing happens with skeletal muscles. The reason why your muscles are big, all right, the reason why is because there's numbers of cells are not increasing. What is increasing is what? The pre-existing mass of this cells are increasing. So because of this, by deposition of protein synthesis, that is why it's going to become hypertrophy. It happens to skeletal muscles, it happens to heart, all right? That's the reason why oftentimes you probably hear a word like left ventricular hypertrophy, all right? Again, I'm repeating this. There's no increase in the number of cells here. There's increase in the mass of the cells because there's a lot of protein synthesis happening. It means that is because of the maintenance of work. Let's say if we take example of heart, the maintenance or the workload of the heart has been increased, all right? So the workload has been increased. So because of that, the heart has to pump more in order to, let's say, in order to have a good cardiac output, all right? Or let's say there is some sort of like a stenosis. Let's say pulmonary stenosis. That means the right ventricle has to like what? Pump against its resistance in order to meet the tissue demands of your cardiac, like tissue demands of cardiac output, right? Because ultimately ultimately what happens is that your tissue only cares about like hormones, nutrients, and oxygen that they're getting, all right? So in order to avoid let's say a heart failure, our heart needs to pump against this, let's say, workload or resistance in order to make the tissue demands, okay? So after this, if there's a hypertrophy, there should be hypertrophy too, right? And hypertrophy is also same. The decrease of what? The decrease of this pre-existing mass. All right? Now, oftentimes what we don't hear is what we hear is something called atrophy, okay, or atrophy. That's something that we have to know. Atrophy. More commonly we use atrophy more than hypertrophy. And the same thing happens here. The reason why is because the organ becomes smaller, the size of the organ, because it lost the pre-existing mass. So if this is a normal size, let's say it becomes like this. Same numbers of cells didn't grow. But this pre-existing mass, it was here, the diameter, that has reduced. Right? That has reduced. And because it has reduced, what is going to happen? Your hand goes to atrophy, all right? And what are the causes that could be there, all right? Guys, whenever we talk about, let's say, atrophy of disease or hypertrophy of any disease, right? You need to always look at two things. You have to always divide every disease, whether it's a physiological or it's a pathological, all right? You have to always remember that because physiologically, all right, your cell can adapt and do certain way, right? Pathological means like same hormone, let's say, same hormone is continuously supplied or overproduction of that hormone, and that is going to lead into the pathological, okay? So every disease has its physiological section, and then pathological sections, all right? So that's the reason why it is really important to integrate the physiology, pathology whenever we're discussing about this concept, all right? And also we have to talk about, we have to know anatomy, histology, biochemistries, pharmacology. We have to integrate all the information so we can have a better understanding of this, all right? So, an atrophy, like what are the causes that can lead into atrophy? Like for example, guys, like think about this. If you break your hand, if you fracture your hand, and if you fracture your hand and if you don't put a cast for like a month, if you put a cast for a month and after you take the cast out, what happens there? Usually your hand is very small, right? Why? is because that you did not exercise that hand. So there's a disuse of the hand, okay? The disuse of the work of the hand, all right? So you didn't use it, so there is a decrease in the workload of the hand. Or it could be that. Or let's say, use another example. Let's say there's a degenerations of nerve. I mean, there's nothing is supplying here. No nutrients, no oxygens are going there. In that case, the cells are going to go very small. So let's say you can say decrease in nutrition, or nutrition imbalance, you can say, or you can say degeneration. There's no nerve supply there. There's a damaged nerve supply. All right, that could be that. Aging is a factor too. Or let's say there's a decrease in endocrine stimulation. Decrease in endocrine stimulations. All right, all of that. All right, all of them leading to like something called atrophy. And one thing that I do have to talk about atrophy is that, usually you see the atrophies more commonly, like obviously in skeletal muscles, but liver, or you see in your heart and also in brain, all right? And there's two couple of things when it comes to atrophy I'll mention here. One is called, or let me write down here, lipofuscin granules, the concept of this. They also call the wear and pink pigment. All right, I'll explain that. So when there's a decreasing mass, what is happening here is that, okay, taking examples of degeneration, right? Let's say there's a nutrition imbalance is there. Nutrition supply is less. If that is the case, then what happens to this cells is, let's say there's a decrease in what? There's a decrease in metabolic activity. If there's a decrease in metabolic activity of the cells, obviously that's going to lead into what? Decrease in protein synthesis of the cells. This is how it leads into this atrophy. All right? Protein synthesis is decreased. Right? Other thing. Then after that, your cells is protein, right? So that means what is going to happen is that there is activations of ubiquitin ligase enzyme. All right? This ubiquitin ligase enzymes will start breaking down, let's say, the proteasomes and breaking down proteins. That's what's going to happen. And, there are also going to be, and eventually what is going to happen is that, let's say in the cell, there are also like what is going to happen here is that then some there's some cells which are starved cells, okay? They need nutrients. And what they do is that they start eating themselves. And what do we call them? We call them like autophagy, right? Autophagy start happening. And then when they start breaking down and eating themselves, they make something called like, autophagic autophagic vacuole. That's what they make. They make autophagic vacuole, right? And this autophagic vacuole, what happens? This vacuole, they kind of like, they fuse with lysosomes, and lysosomes has a lot of these hydrolytic enzymes, okay? They fuse these hydrolytic enzymes, all right? And then what is going to happen is that some of the materials does not get breakdown, all right? It's undigested enzymes. And that undigested enzyme does not break down from the, let's say this, what is this called? From this, lysosomal enzymes, we call them residual bodies, all right? Because that residual bodies, what happens in the cytoplasms? These residual bodies in cytoplasm, what happens is that it get later mixed with the, lipids. I'll explain what does that mean. In the cytoplasm, let's say this is my cytoplasm right here. In the cytoplasm, what is happening here is that, in the membrane, there's a concept of lipid peroxidations of plasma membrane. What does that mean? Meaning that, and that is caused by the free radicals, all right? The oxidative stress of the cells. What is really happening is that, the oxygens, like the free radicals, it requires extra electrons, okay? And it takes an extra electrons from the lipid, all right? That's what we call them a peroxidation, all right? And it is coming from the PUFA, P-U-F, what is this? Polyunsaturated fatty acid, all right? And if I have to be very clear, if you look at the structures of the polyunsaturated fatty acid, there are double bonds there. There's a methylene compound, like methylene, M-E-T-H-L-E-N, methylene, like CH2, right? It takes some electrons from there, okay? And it makes an intermediate peroxidase, all right? Peroxidase. And that is how, leading to the free radicals form. That is what's going to cause, cell membrane damage, all right? So, that peroxidation, right? that these guys, these lipid peroxidations, when they get mixed with those residual bodies, all right, it in the cytoplasm, you see something called like lipofuscin granules, all right? They're called the lipofuscin granules. It's a yellowish intercellular granules that you get to see with the people with atrophy, okay? And they also call this as wear and pink pigment, all right? So this is how you get those lipofuscin granules. If you look at the heart, okay, sometimes what you also see is something called like brown atrophy because of the colors of that, right? So these are different like atrophy that you get to see, right? So, all right, we talk about what hyperplasia is. We talked about what is, hypertrophy is. We talk about atrophies, all right? These are very important ones. Let's talk about, metaplasia. What is metaplasia? Let's talk about this. Metaplasia is referring as, guys, like, look, these cells, let's say these cells, all right? Let's say these cells are, let's say, columnar epithelial cells. We can just make this, all right? I'll make this as, what happens with this is that, there is a change in this. These are already differentiated cells. The cells which are already been differentiated cells, all right? Later, let's say the cells gets, okay, sort of like reprogram themselves, all right? And then they change or they're replaced by another cell. That's what basically the metaplasia basically means. And I'll say what I mean. Okay, so let's say like we'll take out the respiratory tract. We have what? They have those like, the columnar epithelium, right? So let's say this columnar epithelium right here, like this tall column. And on top of it, there's a cilia right here, right? Like cilia. And what does the cilia do? Cilia escalator, they remove any sort of dust particles and all that stuff. But let's say if you're like chronically, you're smoking. When you're chronically smoking, what is going to happen? You irritate the cells, right? You irritate the cells and your cilia gets lost, right? And also the too much of this, it causes this what? It causes the cell it causes too much stress on the cells, so cells cannot handle that. So what is going to happen is that the cells will later what happens, they get replaced by this, there's a loss of that, and let's say loss of that, and replaced by another type of cells, which is called, let's say, like this. And this is called what? The squamous epithelium cells, all right? So whenever you see there is a cells, all right, because columnar, at the junctions of the, let's say, these columnar junctions, right, squamous columnar junction, there's replaced by this flattened cell, which is squamous epithelium, right? This is what is called metaplasia. So if you want to be, and clinically we can call them, this is squamous metaplasia, all right? So just know that whenever it is replaced, or the cells, okay, the phenotypical, the phenotypes of differentiated cells sort of like changed by reprogramming the cells of this and get replaced by another type of cells. That is what's called basically metaplasia. Whenever we talk about metaplasia, there is epithelial metaplasia, there's a mesenchymal metaplasia too, all right? So, and mesenchymal metaplasia usually, you can talk about this or intestinal like epithelium or intestinal metaplasia, all right? Or like, even for bad esophagus that you get to see that. Now, so the four main the adaptations are obviously hyperplasia, hypertrophy, atrophy, metaplasia, all right? And you need to know like this like off your head really well. We also talked about what dysplasia is and aplasia is, all right? And then also we talked about aplasia, atrophy, all of them, all right? Again, it's really important to know this like a definition really well, so you can better and further have a better understanding when you actually talk about this whole the necrosis, because we're going to go very detailed about what is the pathogenesis of the necrosis, all right? Remember, necrosis can only happen in the living organisms, all right? Okay, so when it comes about the overview or general concept of pathology, all right, this is what I want you to focus on this, and then as the time comes, next lecture we'll talk more about the all this stuff. All right, guys, thank you very much for watching, and then all right, good luck, wish you all the best, bye.